welcome to Payment Matters. I'm your host, Jeff Lin. Thanks for tuning in today. On this show, we talk about the ever-changing landscape of healthcare payments and the impacts to healthcare payers, providers, and consumers. You can follow the conversation on Twitter at hashtag Payment Matters and follow me at Jeff B. Lin. Today, we have the privilege to talk about consumer engagement and the billing and payments process. As we all know, today's consumers really are expected to pay more for their healthcare bills. Not only more bills, but also just higher dollar volume, higher dollar amounts. Consumers really have changed their expectations when they look at this, and they look at the other industries like Amazon or Google and Facebook and how they're really changing the entire experience of engaging the consumer. And unfortunately, healthcare has been a little slow to catch up on all these major trends, and really I call it the high watermark associated with the consumer experience leaders in those other industries. But really tied to this, consumer healthcare is unique, right? Because consumers are confused about their responsibility. We've seen this also in the 8th annual Trends in Healthcare Payments Report that says only 9% of consumers can really define common healthcare payment terms like copay, deductible, and coinsurance. And it really hasn't changed year over year. With that being said, this has real consequences when you look at all these factors playing in together. The time spent to collect money from patients, and also the operational overhead tied to the paper-based and manual processes that a lot of these operations have to deal with. And really the key thing here is how can healthcare really engage consumers in the payment process to clear up confusion? And if there's any tools, processes, or even just kind of how we manage people to really make paying healthcare bills more seamless and painless. Today, we want to talk about how healthcare organizations can really leverage technology and best practices to improve patient financial engagement. We have the really honor to have Katie Buzard of Healthcare Administrative Partners. Thank you so much for joining me today, Katie.
Thank you, Jeff.
Great. And Katie, for the audience here, would you like to can you introduce yourself?
Sure, absolutely. Hello, everyone, and thank you for listening to the show. I just wanted to give you a little feedback about myself. I have been working for healthcare industry for over 15 years now, mostly in customer service. Currently, I'm the call center manager with our own in-house call center, which includes 11 representatives. I'm also the training manager at Healthcare Administration Partners.
Great. So can you tell us a little bit about Healthcare Administrative Partners?
Absolutely. Healthcare Administration Partners is a full-service revenue cycle management solution company, and we're servicing specialty provider groups. We mainly bill for radiologists. However, we do bill for some pathologists, emergency department physicians, and pediatricians. Currently, we bill for over 40 different clients in 8 different states. Our practices are primarily based on hospital settings as well as imaging centers.
That's great. And just for the purposes of the audience here, Katie, can you describe, when you say practices are primarily based in a hospital setting, can you maybe explain for the audience what that means in terms of how you guys engage with your patients?
Absolutely. With the hospital settings, we basically bill for the radiologists, the doctors themselves. So we're billing for the professional component opposed to the technical component. As in imaging centers, we bill for both the professional and the technical component.
Got it. Great. And then the difference is what I've heard from the industry is the hospital settings, typically is it more of an independent contractor within the hospital who doesn't have the called the point of service interaction with the patient. Is that do you guys see that today?
Absolutely.
In terms of your radiologists? Got it. So,
yes, you are absolutely correct. Mm-hmm.
Got it.
Most of the times when patients go into the hospital to have an X-ray or an MRI, they're not even going to see the radiologist. They're more behind the scenes. They get the films. They interpret what they see on the films. They dictate what they see, and then we code based on, what the radiologist saw on the films. So most of the times, patients don't even see the radiologist or even talk to them for that matter. In an imaging center, it's kind of the opposite because we do bill for both, and the patients can see the doctors themselves.
Wow. So really kind of big kind of difference in engagement models across your clients. And tied to that, there's clearly some challenges tied to both of those models. What are the challenges you see having to bill and collect for your clients' patients?
Well, Jeff, it really stems from the rising rate of patient cost responsibility. You see the healthcare industry has entered a new era of consumerism, and that's truly foreign to providers. Patients are now faced with high deductible health plans and premiums that increase every year. Many of those patients cannot afford the cost of out-of-pocket expenses. They're faced with monthly living expenses that they're just getting by on. So when the healthcare bills start coming in, they are faced with the decision, do I pay my mortgage or my electricity bill, or do I pay my doctor's bill? And, the reality is most patients are going to choose the mortgage or the electricity bill over that doctor's bill. So trying to get patients to pay those bills in a timely fashion, it does become a challenge for everybody.
Right. And that's a big change, right? So you look at this, and you've clearly been in 15 years in customer service and been involved. And when I say customers, a lot of these customers are not only your clients, but you're probably talking to a lot of the patients that are calling in. How would you kind of view, from your perspective, how things have changed from when you started to today? Have you seen any more questions from patients about their bills, et cetera? How would you characterize their consumer's viewpoint?
When I started, the majority of the insurance plans that were being offered to patients were HMO plans, where most patients, you could go to your doctor's appointment and only have a, $20 copay, and that's all you really owed. The insurance covered the rest. Now the times have changed, and most of the insurance plans are those high deductible health plans, and patients aren't just paying those $20 copays anymore. They are paying $100, $200 for a doctor's visit just because they had a cold. So I think that's the biggest change I've seen over the past 15 years or so, and that's kind of made it difficult for patients to be able to make those payments to the doctors. And also the premiums keep going up every year. You see a 15, 20, 30% increase in the premiums that they have to pay, so patients are paying a lot more out of pocket than they were 15 years ago. And with that comes lots of questions from patients because they don't know why they're paying these bills. Not a lot of patients are going to receive their benefit packages from their insurance companies and actually read them because, most of them are like 40 pages long. So they don't take the time to educate themselves and, end up having lots of questions and become frustrated. And, so I think a lot of the things that we need to do in the future, one being the main point, is educating those patients on what's going to happen when they receive the bill.
That's interesting. So, clearly there's some major gaps, and we've heard this across the board, the shifts in the industry in terms of consumer expectations. Clearly there's been some need for changes from your perspective in terms of to your existing processes to meet these new demands. So kind of what did you do? How did you identify the changes to your processes? Can you maybe describe that?
Absolutely, yes. What we did was really the easiest solution possible to identify certain changes that we made over the past year. All we really did was we listened to our patients. Most patients are willing to voice their concerns, and some more than others. But we as providers, we just need to listen to them and find the right options to engage them in the payment process. So that's what we did here at Healthcare Administration Partners. We implemented a satisfaction survey to find out what the patients have to say about the services that they received. With the result from the satisfaction surveys, we were able to start to see a clearer picture, and we're able to come up with ideas to help patients make those payments in a timely fashion. So for example, one of the biggest results we received from these satisfaction surveys was one of our clients, they did not accept credit card payments. So when you have a client that doesn't accept a credit card payments and patients are faced with paying a high deductible health plan, most of them don't have that amount of money in their checking accounts. You know, they need that extra cushion or help to be able to make these payments. And by taking that credit card payment away from patients, it takes longer for that payment to come in for these providers. So that was one thing we were able to do over the past year is explain that to our provider and say, you know, you would be able to bring in more payments if you offered this option. So really listening to the patients and finding out what is going to best fit their needs to make these payments is really key. And then offer those options once you do your research and see how your payments are going to start to come in a lot quicker, and your cash flow is going to increase as well.
That's great. In terms of your clients that did implement offering credit cards to patients, did you see any benefits, or did they see those benefits when that was offered?
Absolutely. When we got the results from the satisfaction survey, 40% of their patients that called in were upset that they did not accept credit card payments. So once we were able to, offer the credit card payment, not only the credit card payment, we also offered the electronic check as well for this client. And the payments are coming in 22 days earlier than they were prior. So it's a pretty big increase for when we receive the payments.
That's great. And I imagine cash flow especially is important, with all clients. Did you approach any of this differently between the imaging centers or the hospital-based radiologists, or was it consistent across both sets of clients in terms of the increased cash flow?
Well, this one was for just one of our clients, and this particular client was an imaging center. So we have most of our clients do accept credit card payments. We only have a few that do not still accept credit card payments. So what we're doing now is gathering the data to prove to the client that it does work. So we do case studies that we can promote to the providers and see if they will make the change, because it is significant. I mean, if you think about the money they spend on processing paper checks, it costs a lot more to process a paper check than it does to have a credit card payment post to your account. And it takes a lot longer when, if you think about mail time and all of that to get a paper check. So even just taking out the mail time, you're going to see cash flow come in a lot quicker than you would if you only offered those paper checks.
Yeah, that makes sense. And I don't even know where my stamps are. So
yeah, exactly.
Right. Yeah.
And think about that. If you don't have to send in a check every time, look at how much money you're going to save in just stamps alone. I mean, they go up every year,
Right. I don't know where they are, and it's sometimes I completely forget to if there's nothing convenient for me to pay across all bills, it's really tough.
80% of patients would rather make their payment now electronically than sending in a paper check. 20% of patients, they still want to have that paper trail and they want to mail that check out so they know that it gets to us. But 80% of patients, that's a huge amount. If we could switch another 10%, that would be great.
Yeah, no, it's interesting. We talk about, it's not just credit card. You can offer credit card via mailed, right? Someone can mail it in and write their credit card on there. But it sounds like when you're affirming this, in terms of options that you're giving to your clients and their patients, can you describe what type of consumer experience do you offer? Online payments? Is it call center? Like how do you accept payments for your clients from their patients?
We have multiple different ways how we accept payments. So we have on the statements that we send out, patients have the option to pay online through eStatement. They can create their own account and they have options. Most clients offer both credit card payments and electronic check payments right through the online portal. They can also set up their own payment plans or auto draft payment plans where they don't have to remember to make that payment every month. It's automatically going to come out of their bank account. One thing that we did do this past year was offering a payment over the phone, over the automated phone system. I'm going to talk about that a little bit later, but so we try to offer as many options as we can. I can tell you what we're really looking forward to is the pay by picture with the iPhones or your smartphone. With the Millennium Group, everything's electronic for them, so by having that link on your phone where you can just snap a picture of your statement and make the payment right there, I think that's going to bring in a lot of payments as well.
That's great. Yeah, there's definitely a lot of changes going on in terms of payment options, and I think you highlighted the fact of consumers, especially they're seeing new payment options in other industries, and they kind of want to see new payment options available in healthcare. And I just want to take I want to take a quick pause here as if you're just tuning in, you're listening to Payment Matters. I'm joined by Katie Buzard of Healthcare Administrative Partners, and we're talking about patient engagement in healthcare payments. So, this is just an amazing transformational shift that we're seeing. Talking about the nuts and bolts here, clearly these things don't, occur overnight. Maybe can you describe your kind of the new billing and payment processes today? What were the biggest changes you made, and what's been the most successful?
And you're absolutely right. Those changes don't happen overnight. The past couple years, we have been quite busy as we've learned multiple ideas from our patients when we launched our satisfaction survey. So we started listening to the struggles patients were having when they called into the call center. The first idea that we started working on was our statements. Patients are not going to pay for services if they do not know what they're paying for. Statements need to be clear, they need to be concise, and they need to be easy to read. For everyone out there, if your statement is confusing for you, then it will be like reading a different language for the patient. So you want to make sure your statements can be matched to the insurance explanation of benefits, and this will eliminate common questions you might receive from patients calling in. Other options we added to the statement are links to pay online or the option to pay over an automated phone system. So paying over the phone is a newer feature for us, like I said earlier, and the amount patients are paying using that option is outstanding. Each month we've had a significant increase of payments being made by this option. So for example, the increase percentage from month to month, starting in January of 2018, we've averaged a 16% increase, and it's still rising. This last month, we had 2,640 patients choose to make their payment through this option. That's 2 call center reps.
Wow.
Taking payments in 1 month for our call center that we don't have to pay for.
Wow, that's great.
And the amount of patients making those payments over the automated phone system, it just tells us that they like that option. And then we made a very bold move, I think, by removing the coupon and the return envelopes from our statements. The reason why we made this change is, as you know, it costs the facility more money in processing paper checks opposed to electronic payments. And we wanted to prompt the patients down the path of electronic payment as opposed to sending in paper checks. So right away, we noticed a decrease in paper checks and an increase in electronic checks. We had an increase of portal usage through the InstaMed website. And during the testing phase for one of our clients, the first month we saw a 32% decrease in paper checks. And in the next month, there was a 47% decrease. That's pretty huge. So even though we took away those coupons and return envelopes, patients are still finding a different way to pay. And they seem to like making those payments because they can see it comes out a lot quicker out of their bank accounts and they know what the money went towards.
Wow. That's an amazing and bold move on that part. Did you see any negative reaction when you took that bold step? It sounds like a lot of big benefits here, but any concerns or comments?
Well, like I said earlier, 20% of patients want to stick to their paper checks. So, right. Of course, we have had some, a little pushback from patients, calling in saying, what do you mean? I have to buy my own envelope. But we did some research around different companies and different facilities and noticed that a lot of them are removing those return envelopes, so we kind of wanted to try that. And I would say we probably get maybe 2% of people, unhappy with this change, but they adapt. And the longer we go with removing those items, the less complaints I have been receiving. So, but even 2% isn't that huge of a number of unhappy patients. And if they're really upset, we'll just send them an envelope and they can mail in their payment.
No, that's great. And was there any material impact in terms of, I imagine if I was in your shoes, I'd be like call center volumes would triple and go through the roof, or reduced payments would occur for those clients. Did any of those negative things, did you experience any of those?
It's actually kind of funny when we did analyze this information. We saw a 20% increase on the online portal, and we saw a 10% decrease in the call center.
Wow.
So patients weren't calling us as much, and we were getting our payments faster, and we didn't have to fuss with mailing out statements and, and paying for stamps and all of that either,
That's great. Katie, these are just amazing results, as not only have you really supported and really delivered value to the clients, but it sounds like you've also were able to engage consumers in a way that they wanted to pay their bills, which is hard to do.
It is very hard to do.
It's hard to do. It's almost a win-win. As I look at this in terms of if other healthcare organizations are looking to improve patient engagement, what's your suggestions, or what should they be thinking about?
My suggestion is listen to your patients and engage them in the payment process. It'll lead you to happier patients, higher payment collections, and optimized practice reputation, and it will lower your cost. So give them those options that they're asking for. A lot of them, they do take some time to set up, but once you set them up, it's so worth it. And patients are so much more happier. And
everyone gets paid, which is right.
And everybody gets paid in a timely fashion.
Yeah.
And less people are going to collection companies, and a lot of people end up there. So it's good to give them options and listen to what they want is really the biggest advice I can give everybody is just listen to your patients and educate them.
That's, Katie, once again, thank you. This is great insight and really great experiences in terms of really making a big impact on patient engagement. And, really, these are the key payment matters we're tackling today in healthcare. And I do want to thank my guest, Katie Buzard of Healthcare Administrative Partners.
Thank you.
Yeah, where can our listeners go to learn more about your organization?
Yes, absolutely. Please check us out on our website. It's hapusa.com. You can also follow us on Twitter as well. Our handle is at HAPUSARCM. We have also recently launched a Twitter account specifically tailored to serve our medical coding clients as well. So you can follow us at HAPUSA Coding as well. And we do create quite a few articles and post them on our website that has a lot of really great information, especially with radiologist billing. Great.
Well, thanks once again. This is, valuable for our listeners and everyone out there. And thank you to all of you for listening in. Remember that you can listen to this episode weekdays at 4:30 a.m., 12:30 p.m., and 8:30 p.m. Eastern. If you have a comment about the episode of the show, follow #PaymentMatters or connect with me on Twitter at Jeff B. Lin. You can learn more about my show at healthcarenowradio.com or at www.instamed.com. Until next time, I'm Jeff Lin. Thank you.